Now, this is an exciting but also a somewhat unnerving report. Here to tell us more is an expert who is also performing similar research into treatments for depression, Malek Bajbouj, a psychiatrist at the Charité Hospital here in Berlin. Thank you very much for joining us, Mr. Bajbouj. Now, this kind of neuro research looks like it could be somewhat dangerous. Could you tell us some of the risks that might be involved?
Every surgery is risky, of course, and you usually have risks and benefit of such interventions, and the benefits are clearly more, and people are becoming better, getting out of the depression. But there are risks, of course. Bleeding is possible, that there can be infections while you're doing the surgery. But still, I think the benefits are much overweighting.
So the benefits are better than what the risks may be. But for example, could you change someone's personality?
Personality usually is something which is a trait, so you have it your whole life and you do not change the way you see certain things, you see the world, and your character is more or less stable, and usually you do not change this by this neuromodulatory intervention.
Could you compare this type of treatment to, for example, electroshock treatment or electrotherapy?
I think the biggest difference is its focality. So in electroconvulsive therapy, electroshock therapy, you stimulate the whole brain, so every single neuron of the brain, more or less. In this deep brain stimulation, you target specifically a brain area which you think that this is involved in depression.
Okay. Now, you yourself are treating patients with depression, and you're doing something quite similar to the people in this report. Have you had a similar success story?
We had comparable success stories. So the last patient, for example, just wrote me a postcard from Spain. She was traveling too. So 2 weeks ago, I received this postcard. And before that surgery, she had been at home for 5 or 6 years, did not leave her home, was just lying in her bed. So there are these success stories. It does not help in every patient. 2 out of 3 do have a response, improve in a very good way, but 1 out of 3 do not usually.
Do you always use the same, do you always focus on the same part of the brain for every individual?
That's a quite complicated question, since there's a whole network of brain areas which is involved in depression, and there are a couple of nodes which are possible targets. And we, for example, use a completely other target than people in Bonn do, and that's still part of the research we're currently doing to find the right spot.
So you don't really know what the right spot is to hit then?
We know that there are a number of candidate spots, 5 or 6, and targeting those does help in most of the patients, but we are currently fine-tuning it, and we are looking which one is the best.
Okay. Now, medication, of course, for depression has serious side effects. So is this treatment really something that's going to be a great alternative? There's not going to be as many bad side effects?
I would say that in a couple of years from now, that there will be an amount of patients, maybe 10%, with very, very therapy-resistant depressions where other interventions do not help, where we can help with this deep brain stimulation. Not for all, but a large and relevant amount of patients.
Malek Bajbouj, thank you very much for joining us here in studio. It's been very interesting.
Thank you.